Let's take a quick look at this photo below and let's agree from the onset that you didn't see anyone naked. You're not a young person who saw someone elderly naked and then you developed this. Today, let's just quickly explain this, because if this was actually true, that when you see someone naked who's older than you and then you develop this, I think many of us should be developing these things. So today, let's draw a distinction of what this looks like and also what you can do about it. Now, I know that what you're looking at right now might look as if it's one condition, but these are actually two separate conditions. One is called a Stye, which is one that we usually refer to as 𝐀𝐍𝐿𝐄𝐋𝐀, and then the other one is called a chalazion. This one is a little bit bigger. Now we're going to draw a distinction between these two so that we actually know, because sometimes the treatment between the two of them might actually be different when they persist for a long time. So we'll differentiate them into four parts. Number one is the cause. The cause for both of these is actually the same, and this results from blocked ducts that protect your outer lining of your eye. Now your eye, for it to be that moist, it has certain glands that produce certain kinds of liquids just normally to protect that outer lining. This is why your eye is not dry, it just remains very moist and there's something protecting it on the top layer. Now these glands themselves can become blocked, and when they become blocked, they form a chalazion, this one that's bigger. Now mostly you will notice that the same thing can happen in a Stye, but a Stye has a clear-cut distinction because there's an infection that is present. So a clear difference here is that a Stye, which is 𝐀𝐍𝐿𝐄𝐋𝐀, that small one looking like a pimple, it usually is infected, but the other one isn't. Now in terms of the appearance, like I said, a Stye looks like a pimple and it's usually very painful. And why is it painful? Because there's an infection there present. So it's usually found in the front part. So like your eyelashes, you'll find that it's just somewhere very close there. It can be outside or it can be inside the eye. Just like when you flip your eyelid, you will see it inside. However, a chalazion is a little bit further away from the hairs. It's found a little bit outside. And this one, you can even actually touch it, it feels a little bit bigger. And when it comes to the symptoms, you usually feel the sensation like you've got something in your eye when you have a Stye, because it can be found inside or on the outside, and usually comes with a lot of pain, like I said, because of the infection that's there. When it comes to a chalazion, pain can be there certain times, but it's not usually frequent. And this one usually comes with, maybe if it grows too big, you start to have some difficulties in vision and whatnot, but usually this one is not usually painful. So when it comes to a treatment, normally these two things should resolve on their own, but the durations differ. For a Stye, which is 𝐀𝐍𝐿𝐄𝐋𝐀 again, is that this one will resolve within a few days, even up to about 7-10 days. It will resolve on its own without anything really. But then if you do want to treat it, you can use a warm compress. Now the warm compress itself, you can use anything and do it about 10 to 15 minutes, and you do it maybe 2 to 3 times a day. The warm compression itself allows for easy circulation of blood, which allows that same particular area to heal. The same applies for a chalazion. Now a chalazion itself usually is very stubborn, so it can last maybe even about 3 months or even actually more. Now, when you do these warm compresses, you notice that it's not resolving. For a chalazion, by the way, this is when you have to come to the hospital. Then your doctor can then give you certain medication like steroids, which can help reduce the inflammation that's happening there. If that doesn't work for a certain period of time, you are then going to go in for a minor surgical procedure where you don't have to sleep. It's just done literally on your eye there. It has to be opened, drained, and the rest is history. A very simple procedure. So remember that a Stye, which is 𝐀𝐍𝐿𝐄𝐋𝐀, or a chalazion, has nothing to do with anything that you have to see someone's nakedness and then you develop these things. Actually, other causes involve a very poor hygiene. So if you're just someone who's not as so clean, you can end up developing these things. Or maybe there are certain people who usually have certain eye conditions around your eyes, so that one can predispose you to develop this condition. And also, my good women, you're also in the business of doing your lashes, doing your makeup, you use cheap stuff and you end up hating yourself, then you can predispose yourself from developing these things. So nothing to do with nakedness, it's as simply a blocked duct.